Can RK or LASIK cause keratoconus? So this is a bit tricky because sometimes when surgeons were looking at the cornea and checking the shape and the thickness of the cornea, a lot of times back in the 90s and early 2000s, the equipment wasn't available, or some surgeons just didn't have access to that. So they were looking at certain measurements and thinking the patient was a good candidate for that type of procedure. But then what ends up happening with some of these patients that may have developed keratoconus over time or developed something called post-LASIK ectasia, those types of patients are the ones that we end up seeing. It's not as common anymore because the technology to scan patients before they have LASIK surgery is so good, but we do still see patients that had surgery in the late 90s and early 2000s that did end up developing keratoconus or post-LASIK ectasia after refractive surgery.